Sleepwalking, which you've all heard of, I'm sure, called somnambulism. Boy, that's hard to pronounce. We are talking non-REM sleep. You're not dreaming when you're sleepwalking. Why is it non-REM? Because when you have REM sleep and you're dreaming, your body's paralyzed, so it's not going to be able to walk. It's usually early in the evening and typically during deep sleep, stage 3 or stage 4. To call it sleepwalking, the person has to literally get out of bed and walk. Now, sometimes it's more than sleepwalking. They may go down to the kitchen and fix a sandwich, but apparently they never wake up because they're not aware of it at all the next day. We don't know much about sleepwalking. Fortunately, it's not terribly common. It's more common in young people than older people, so we do see it in children and adolescents more. A recently recognized, at least formally, disorder, although certainly one that we were aware of for a long time, is called restless leg syndrome. That's literally moving your legs throughout the evening. It makes you a really bad bed partner because you're kicking the person next to you a lot. This movement often results in difficulty sleeping because the movement will sometimes arouse you from sleep. It's more prevalent in females and occurs more during pregnancy, and it may simply be discomfort from the changes in shape of your body not allowing you to find a comfortable position that you normally would sleep in. It can disrupt sleep. It can disrupt sleep seriously, and it can disrupt sleep not just for you, but for your partner. Medications and other substances definitely have an effect on sleep, and you'll be surprised by some of the effects. With any medication, if you find yourself having difficulty falling asleep, staying asleep, finding your sleep disrupted, look closely at the listing for the medication. It may very well be a side effect, and it may very well be that the doctor should consider a different medication for you. One of the most common substances that is clearly misunderstood with respect to sleep is alcohol. If you have a few drinks, you will often fall asleep more readily than if you don't have a few drinks. And quite frankly, sometimes people use alcohol as if it was a sleep medication. They'll have a couple of strong drinks and then go to bed. Well, two things happen. First of all, you fall asleep, but you don't sleep very well. And at some point, you wake up and have a great deal of difficulty falling back to sleep. Using alcohol as a sleep medication is counterproductive. You will get less sleep under alcohol and less refreshing sleep under alcohol than you would get if you did not drink alcohol. A relatively uncommon process is REM sleep behavior disorder. Now, since your body's mostly paralyzed, typically you're not going to be moving, but you'll be talking. And the vocalizations can be pretty intense, even though you're not moving. We don't know much about REM sleep behavior disorder. In fact, most people during REM sleep find that the muscles that control voice are also paralyzed, so they don't typically have that problem. When we treat it, we usually use benzodiazepines. Benzodiazepines are often used to treat insomnia. You see commercials for them all the time. Ambien is a benzodiazepine used to induce sleep, and Ambien seems to reduce this REM sleep behavior disorder as well. Okay, what treatments do we have for sleep disorders? As I mentioned, benzodiazepines, things like Ambien, will work for insomnia. There are also sleep aids that are available over the counter. Many of them are antihistamines, where the primary goal of the antihistamine is to reduce histamine activity and therefore make the effects of allergies less dramatic. You'll sneeze less, etc. But it makes you drowsy, and the drowsiness, which is a side effect if you're taking it for a sinus problem, can be the primary effect if you need to sleep. Again, though, if you take these drugs on a regular basis, you can become, I won't say addicted to them, but you will become so used to them that when you stop taking them, you're not going to be able to sleep very well. People who sleep too much or fall asleep quickly, hypersomnia or narcolepsy. Stimulant medication is usually used. Often it's something like amphetamines or the Ritalin that is typically used to treat ADHD. If your narcolepsy includes cataplexy, where your entire body collapses, they'll typically use antidepressants, mostly selective serotonin reuptake inhibitors. With breathing-related disorders, sometimes just simple weight loss helps, occasionally surgery, but by far the most common thing is something called a CPAP machine. Stands for continuous positive air pressure. Typically it's a mask over the face with a device that is pushing air in all the time. So when you are breathing, it forces you to breathe more. If you stop breathing, it literally pushes air in. Think of it as a ventilator without being quite so forceful. A ventilator breathes for you. I am recording these during the COVID-19 virus. We probably all learned more about ventilators than we ever wanted to do. It turns out that many people who are having difficulty breathing, but not so bad that they need to be on ventilators, can be handled reasonably well by simply putting them on a CPAP machine. Part of the problem with COVID is that you're not breathing enough, so your blood oxygen level drops too low. Now, those are all physical treatments, either medication or devices. We also have psychological treatments. They vary depending upon the nature of the problem that you have. If you have a circadian rhythm disorder, perhaps jet lag because you flew across too many time zones, your body doesn't know when it should go to bed and not. I already talked about a way of dealing with that. No matter how tired you are, set the alarm for about the time that the sun rises. Don't even bother to take a shower, put on some clothes, go outside for a walk, and experience the sunrise. Let your body experience it at the time the sun is actually going to rise. That helps you to set your body clock. And if you do that every day for 2 or 3 days in a row, typically that will be just fine. You can do the same thing with the bright lights that were used to treat seasonal affective disorder, essentially creating artificial sunrises. And in fact, you can do that by doing it gradually, so that you essentially cross 2 or 3 time zones or their equivalent each day, and your body is generally able to adapt to that just fine. The other thing that is helpful with sleep is to improve what is called sleep hygiene. That is, sleeping in ideal circumstances. We'll talk about those in just a minute. One of the ways of making it more likely that you will not have sleep problems is to maintain a regular schedule. Your body likes regular schedules. It really does. Our body is designed to maintain homeostasis in a variety of mechanisms on a variety of variables. So if we go to bed at roughly the same time, if we get up at roughly the same time, we'll do just fine. Young people in particular don't do that. And quite frankly, I didn't when I was younger either. So you get up for class. Maybe your first class is at 9 o'clock and you get up at 7:30 and get to class just fine. on Monday through Friday. But then Friday you go out partying. And you can get in 3 in the morning and maybe it's 4 before you fall asleep. Well, you don't want to get up at your normal 7 o'clock or 7:30 time if you've only been in bed for about 2 or 3 hours, so you sleep till noon. Now, because you slept till noon, you're probably going to stay out late on Saturday night and sleep late again on Sunday. But you got to get up early on Monday, so you try to go to bed at your normal time, maybe midnight, but your body doesn't want to. It hasn't been awake enough. You've essentially shifted your time. If you want to avoid difficulties, and usually the difficulty is on Sunday night, because you're shifting from this sleeping in over the weekend to having to get up in the morning, don't sleep in. If you want to go out and party, fine. Go out and party. But set the alarm for the normal time you would get up. Now, you're going to be tired. You'll want to sleep more. But your body will wake up, and your body will find it easier to fall asleep earlier the next night in situations like that. Keep a regular schedule, and it'll be much easier for you to be able to maintain a proper sleep cycle. There's an interesting phenomenon that occurs with daylight savings time. In the fall, remember spring forward, fall back. In the fall, you lose an hour. And in the spring you lose an hour. In the fall, you gain an hour. You don't notice anything on the Sunday that occurs. But on the Monday, the next day, where everyone's got to get up at a certain time determined by the clock, not by the sun at that point, there's about a 15% increase in accident rates on the highways on the Monday following daylight savings time going into effect, and about the same decrease in accident rates on the Monday when daylight savings time goes off in the fall. That's a pretty strong indicator that most adults are sleep deprived, and you take an extra hour out of their sleep, and the sleep deprivation reaches a level that their performance is decreased significantly. There are a variety of other things that will help with your sleep. Learning to relax helps. When we talked about anxiety disorders, we talked about how hard it is to tell yourself to relax, but that you can teach yourself to relax the muscles of your body, usually one at a time through something called progressive muscle relaxation. And that'll make you feel relaxed, and it'll help you to fall asleep more readily and to stay asleep and get more refreshed sleep. You can also reduce your stress. Often that's a little harder. Typically, you have to change things in your life. If you're stressed out because, well, you've got a couple of papers coming up and you don't have enough time to do them, maybe the way to reduce your stress is to start working on your papers earlier so you're not pushing those deadlines. You also need to be reasonable about sleep. Now, we've all had this experience, so I'm going to describe it probably the way you felt it. Some people have this experience almost every night. They go to bed, and they knew they stayed up a little longer than they should, and maybe, okay, they worked a little too long, or, they were just too active, and they're too wound up to fall asleep, and they want to fall asleep. So they lay there and they say, fall asleep. Well, the more you try to fall asleep, the harder it is to fall asleep. You fall asleep by letting it happen. You can't force it to happen. So you try too hard, you can't fall asleep, you look at the clock. Okay, you planned on going to bed at midnight, you went to bed at 12:30, and now it's 1 o'clock, and you're thinking, okay, I gotta get up at 7. Okay, if I fall asleep in the next 5 minutes, then Okay, I can still get 6 hours of sleep. I can go on sleep. So you try harder to fall asleep, and suddenly it's 1:30 and then 2 o'clock. And you keep watching the clock, and the more you watch the clock, the more wound up you get, and the harder it is to sleep. And you keep being recalculating. If I fall asleep in 5 minutes, I can still get 5 hours of sleep. And eventually you get to the point where you're going to get far too little sleep, and you're just going to be dragging the next day. If you fall asleep in 5 minutes, and some of you may actually do that, it's almost perfect evidence that you're not getting enough sleep. A normal person who is getting the proper amount of sleep typically takes 20 to 25 minutes to fall asleep. And you probably take longer if you are too active just before you go to sleep. I work long hours, but I stop working about an hour before I fall asleep because it takes me an hour to wind down enough that when I go to bed, I can fall asleep. If I don't do that, if I work right up to going to bed, I go to bed and I spend an hour trying to wind down before I can start focusing on sleep. And I'm no different than anyone else. There are medications that are sometimes combined with behavioral techniques to usually things like relaxation. The two together sometimes can help with sleep problems such as insomnia. It would be nice is every time you went to bed, you fell asleep, you woke up at the end of a good night, you were refreshed, you were ready to face the day. But that's not going to happen. You're going to have some good nights of sleep and some not so good nights of sleep. The key isn't to have a perfect sleep cycle, but rather to do the best you can to get regular sleep and enough sleep to be able to function at a reasonably high level. I already mentioned having a regular sleep schedule helps tremendously. Avoid sleeping in on weekends because it just is going to make it hard for you to get the sleep that you need. Certainly stimulants like caffeine and nicotine can make it very hard for you to fall asleep. The ideal environment tends to be cool. If you don't have air conditioning and it's a hot, humid night, you know how miserable it is and how hard it is to fall asleep. If it's a cool environment, dark, relatively quiet, you are more likely to fall asleep and sleep comfortably. You need to be aware of what sleep involves, that it takes some time so that you don't put pressure. Parents often don't understand the sleep needs of their children, and as a consequence, they give their children some bad advice on that. Adolescents, especially high school students and often college students, are usually severely sleep deprived because one, they need more sleep than adults do. And two, they don't get anywhere near enough sleep. They tend to stay up too late. They use things like social media and the internet to keep them active, sometimes well into the late night hours. And three, in high school, they typically want you there at a ridiculously early hour. Some schools are recognizing that it makes more sense to start classes at 7:30 for grade school children, but 8:30 for high school students, because the natural sleep cycle for high school students has them sleeping later. And interestingly enough, the high school student in schools where they start a little later and go a little longer tend not to simply adjust their time to go to bed so that they still are sleep deprived. They tend to go to bed roughly the same time as if the high school starts its classes at 7:30 in the morning. I already mentioned alcohol. It may give you the illusion you're falling asleep. It's an illusion. Don't drink alcohol. Don't do heavy exercise. If you do heavy exercise or anything that's terribly arousing, what's going to happen is it's going to take your body a while to settle down. Remember, you can't make yourself sleep. The body has to let itself fall into sleep. Nightmare disorders are usually treated with antidepressants, specifically SSRIs. You may remember that's the treatment that's often used in PTSD, so it tends to work with the nightmares found there as well. And relaxation training, especially with children, is effective. With sleep tears, typically, we don't do anything, especially with children. And usually within a month or two, what happens is they go away. That's pretty hard on the parents for the month or two when their child is waking up frequently with these terrifying screams. But usually it will go away all by itself. Our last topic is elimination disorders. The two elimination disorders we're going to talk about are enuresis and encopresis, and we're going to cover them very lightly. First of all, in order for us to be healthy, we have to take in energy. And we have to regulate the amount of water in our system. The water serves all kinds of purposes. Roughly 85% of our weight is water. If we have too little water in the system, our blood pressure drops because water comes out of the bloodstream. Most of the bloodstream is water. And so we have too little blood pressure to be able to move the blood to where it needs to go. Water comes out of our system and stored in the bladder. Along with the water in the bladder will be waste that are removed from the system through the kidneys. All of the food that we eat, some of it can be converted into energy, but some of it cannot be converted into energy. It goes through our digestive system. A good portion, not necessarily all of it, but a good portion will be absorbed and turned into energy molecules. And the rest is waste, which will be expelled as feces. That's just the normal functioning of the body. It's no different than a power plant, which brings in coal or fuel or something and creates the energy and has waste products. So we have waste products as well. We need to remove those waste products. Now, when we are infants, we don't have fully control over that. So what happens is we're in diapers. And when our bladder gets too full, it just spontaneously empties into the diaper, and the same with our bowels. So our feces will be in the diapers, and it'll be kind of smelly to change them, but parents get used to that smell after a while. As we get older, we develop control, and parents potty train their children so that they can go in the proper place at the proper time. And at some point, they will be able to do that reliably. Now, there are differences between that. Some children will be wetting their bed until they're 10 years old. Many children will no longer be wetting their bed at age 5. So there are developmental differences in terms of getting full control. Enuresis, which involves the elimination of your urine at inappropriate times, and encopresis, which is the elimination of your feces at inappropriate times, sometimes are nothing more than developmental delays. Occasionally, they may represent other things, so let's talk about them briefly. Encopresis, which is essentially going number 2. Most of the time at night, when you're not in full control of your bowels. It typically ceases to be a problem by age 4. Enuresis can go longer than that. So in most cases, the child will not have a problem after age 4. Now, it's very important here. When we talk about the age, we're talking about a chronological age. But when we talk about individuals who have severe intellectual dysfunction, we translate that age into the mental age. So you might have an 8-year-old with severe intellectual dysfunction whose mental age is just 4. So they may very well suffer from encopresis because, frankly, their body isn't developed. It's not mature enough to be able to control their bowels. Now, why does encopresis typically stop earlier than enuresis? Well, 2 things. Encopresis, if we have a regular cycle, is something that we typically tend to do in the morning and not all day long like we do by going to the bathroom and eliminating our urine. We take water in constantly all day and we are filtering it out and filling our bladder with it all day. We tend to do a little less at night. Why do these things occur mostly at night? Because if you're sleeping, you simply don't have the same level of muscle control, especially when you're young. And some young children sleep so deeply that they have no awareness. How is it that you know to wake up because you got to go to the bathroom? Well, it's because you're in a light enough sleep and you are sensitive enough to pick up the fact that, oh, my bladder is full, I should get up and go. But if you're a young child, you may not have those skills yet developed. There are behavioral techniques that are effective. One of the behavioral techniques is to just make sure that you go to the bathroom before you go to bed. Diet can help. What diet does is if it provides enough fiber, it becomes easier to go to the bathroom when you need to go to the bathroom. And rather than essentially having the feces become harder and harder and not move when you need it, and then you've just got enormous pressure that you can't stop in the middle of the night. Enuresis, which always involves wetting yourself at night, although occasionally it can happen during the day as well. A lot of factors contributing here. It tends to run in families. And we believe on the basis of some studies that it's probably genetic, but we don't know exactly what the genetic contributions are. It may be as simple as some people tend to sleep more deeply and therefore are less likely to awaken themselves when their bladder is full. Remember, when your bladder gets full, it will want to spontaneously release. The young child initially does not say, I want to go to the bathroom when they're in diapers. They just go. When their bladder is full enough, there's an automatic signal. Unfortunately, probably many of you have experienced the thing where, okay, you need to go to the bathroom, you can't go to the bathroom, the pressure in your bladder gets more and more intense. And if you can't find a bathroom in time, you may be terribly embarrassed because you will lose control. It's natural reflex. The pressure, if it's too great, is going to want to decrease by opening the sphincter muscle that is holding back all of that urine. Now, if there's any problem with the bladder and the muscles that control the bladder, that can certainly contribute to it. That's not usually the case with children. It is more commonly the case with older people or people who have neurological problems that contribute to severe intellectual dysfunction. We've been talking about jet lag, and for us, that usually means that we want to sleep when we should be awake, and and we're never sure when we're going to be hungry and things like that. Well, to a younger child, those rhythms are very important. And so they may find themselves wetting their bed more, again, because their cycle is all off. Toilet training is hard work. It takes a lot of patience for the parents, and it takes a lot of effort for the child. Freud talked a lot about toilet training, and frankly, I think a lot of his ideas around there were not based on much fact. But parents will tell you that toilet training is not an easy time for the child or the parents. If it's not done properly, what will happen is that the control of these very important functions will never quite be right. If you do a lot of driving or something, you may find that not being able to go to the bathroom when you feel the need to go to the bathroom is hard on you. And it becomes harder and harder to control things if that goes on an awful lot. And stress can contribute as well. Now, it turns out there is a very easy treatment and a very effective treatment that's been around for a little more than 60 years. It was first sold by Sears and Roebuck. And it's a simple device. It's a pad that goes underneath the sheet on the mattress, about where the hips are. The pad has some metal wires going through it and crisscrossing. Urine will connect those circuits, and it will make a sound, a bell-like sound, an alarm that's loud enough that it'll wake the child. What this does basically is it awakes the child at the first sign of loss of control of their bladder. And very quickly, the child learns to recognize the feeling that they're about to lose control, that they have to get up and go to the bathroom, through this kind of feedback mechanism. Now, it wasn't developed by a psychologist, so it was just kind of a clever idea that someone came up with, but it follows psychology principles beautifully, and it works, and it's inexpensive. And uresis is not the end of the world. And virtually all children with normal intellectual functioning will grow out of it completely. But when you're 9 years old and you can't comfortably do a sleepover with your friends because you're afraid that you might wet your bed, it's a big deal. So having something like this, that's a simple and easy way of treating the problem early on, is a godsend. So this was a big chapter with lots of material, generally material that was unconnected with one another. So we talked about eating disorder, anorexia, bulimia, binge eating disorder, and also we talked a little bit about obesity and how the people fighting obesity sometimes create situations that make eating disorders more common. We talked about treatment for those disorders. We also covered two other topics in this chapter: sleep disorders, both dysomnias and parasomnias, what we know about them and the best way of managing them, and then briefly at the end, elimination disorders, enuresis and encopresis.